I'm Claire Davis, and I am back with Mental Health Chats, and we are working with you for better emotional fitness. And today I've got Sylvia Chambers with us. Hello, Sylvia. How are you?
Hello, Claire. I'm fine, thank you. And you?
I'm very well, thank you. So, Sylvia, would you mind, because Sylvia's coming at this at a slightly different angle to our previous guest, so would you mind telling everybody what you do?
Okay, so I am an RMN, which stands for a registered mental health nurse. And I've worked in the NHS mental health for the last 37 years.
Yes.
Yes.
Okay, so today's topic is on self-harm. So what do you do with regards to the self-harm side of things with regards to being a mental health nurse?
So I suppose that most of my experience around mental health nursing has been with regard to assessing people, perhaps and most commonly after a self-harm event. So it's been my job to conduct a full psychosocial assessment to unpick what's happened and to explore perhaps how somebody is feeling and about their life history and about the circumstances that have led to somebody harming themselves.
Okay, well that actually leads on to my next question, which is really interesting. Why do you believe people self-harm?
Oh, Claire, that's a very complex issue, and sometimes it's not about one single reason. I suppose if I had to summarize what the main reasons are, I think it has to do with sometimes releasing or connecting with physical pain as a way of connecting with how somebody feels internally and emotionally. So I think there's that whole physical pain, the idea that when you self-harm, you feel something. And sometimes when people are deeply distressed or overwhelmed, then it's not always about a huge amount of outward distress. Sometimes there can be a sort of numbing feeling or a disconnection. And I think sometimes self-harm helps people connect again to themselves. It's a way of having control over how you feel and over yourself. And I think that's particularly true for people maybe who have experienced past trauma. I think sadly it's sometimes a way of punishing yourself. Maybe that's tied up with how you view yourself, your self-esteem, your self-confidence, your self-worth, and actually doing something to harm yourself again can be just a way of punishing yourself. And I think the other thing about it is that it's a way of communicating outwardly your distress to other people, because sometimes it's very difficult to explain how you're feeling.
Yeah.
Very active self-harming is an outward, display. It's an outward message to other people. I think my other caveat I would like to say is that the one thing I absolutely believe that self-harm is not attention-seeking behaviour. And I can't say that strongly enough, that I think that's a misconception. I think that is born out of a lack of understanding, and it's a judgment that is terribly unhelpful by professionals or friends or the public or whoever. So it is not about seeking attention. It's a way, it's sometimes repeated self-harm becomes a way of managing very difficult emotions. So it starts as a solution, if you like, and then it becomes part of the bigger problem. So
that's so interesting, Sylvia. It actually aligns with what 𝗖𝗵𝗲𝗀𝗀𝗀𝗀 has said. And 𝗖𝗵𝗲𝗀𝗀𝗀𝗀 goes into organizations to talk about self-harm, and it really aligns with that. So thank you for that. So would you mind just elaborating a little bit more on what you have seen self-harm to actually be?
Yes, I think sadly I have seen people self-harming by cutting themselves using sharp instruments, knives, razors, blades of some sort. Cutting, I've seen people burning themselves with cigarettes or with lighters. I've seen people perhaps, swallowing, so either overdosing of medication repeatedly, or perhaps swallowing foreign objects, things like batteries, coins, all sorts of different things. I think as well that we often overlook that sometimes some risky behaviour, perhaps connected with use of alcohol or repeated drug taking, sometimes that is a way of self-harming as well. And then I think that there are other, and I might be quite controversial now, but I think that my experience was that sometimes I saw slower, longer term self-harming behaviours, things like very excessive tattooing, having repeated tattoos completed, or cosmetic surgeries even. That sometimes when you looked a little bit deeper than somebody's personal choice and preference, sometimes there were issues there with regard to people's self-esteem, or then perhaps some trauma from the past. So I think self-harming for me is something that I would, it can be very distressing to witness. It's watching somebody assault themselves can be hugely disturbing and upsetting. And I think it's just important to look past the behaviour. It's very important to understand the circumstances around somebody self-harming, because then sometimes you can perhaps understand the triggers, and you can perhaps agree with somebody a sort of a risk management plan to try and reduce the amount of harm to themselves, because people often feel shame and guilt and are left with physical as well as emotional scars afterwards. So, it's a very complex subject.
It is. And it actually goes on to my next question, what you've just said. Watching somebody who's harming themselves, living with somebody who's harming themselves, or if you're a friend of somebody who's harming themselves and having close proximity. So what advice would you give someone who is having to support somebody who is self-harming? Because it does get very emotional, doesn't it?
And it's a very risky behaviour. I know that you've covered suicide in another of your chats. Sometimes self-harm and escalating self-harm is a way of the person almost desensitizing themselves So it must always be taken very seriously, I think.
Definitely.
What I'm saying. I suppose I have less advice for families and friends, except to say I think seek professional help. Don't try and contain it yourself, really. I think it is very, very difficult, as being in a relationship with somebody who is self-harming. I think it's perfectly okay to tell somebody that you're very worried, that the behaviour upsets you, and you think it's perhaps an indication that somebody needs some help and support, and you would like to assist them doing that.
Yeah.
I think for an individual themselves who's self-harming, is that okay? Just to cover, I think try and find the courage to tell somebody that you trust that you have a problem with this, and any professional, anybody like myself, or a GP, or just somebody you trust, a teacher, even if it's a younger person. My guess is anybody who works with other people and has experience of this is not going to be shocked or repulsed, or not going to judge, I hope, what you're telling them. So find some courage, tell somebody that you trust, ask for some help, would be my number one tip regarding this. I think what then you can expect is that somebody will listen carefully, will try and unpick and explore how this behaviour started, why it started, was there some trauma, what are the risks with this behaviour continuing. That there are risks even with cutting, and there's risks of infection, there's risks of scarring, there's risks of blood loss, and like I say, underlying what always concerns me is the ultimate risk of suicide if people escalate self-harming behaviour. So what you would expect, I hope, from a professional is thorough assessment, and then a careful management plan that's formed with you about how to manage this behaviour. So, different things work for different people. Sometimes trying to minimise the harm, perhaps still getting some physical connection or physical pain even, but in a way that is not harmful. And certainly I've worked with people in the past that have used rubber bands to afflict themselves with, or ice cubes. And for those that say, no, I absolutely have to cut myself, it's about doing that in a safer way, with a clean implement and then having dressings available afterwards, for example. So the ultimate aim, obviously, is to reduce and to stop self-harming. But there are different ways of coping with emotional distress. I think ultimately, longer term, what I'm always aiming for is that somebody can achieve stability, because I think sometimes when people are caught in that pattern of repeated self-harm, then emotionally they're likely to be quite dysregulated, what we call dysregulated. So there's their moods change very, very quickly. So ultimately, hopefully what you're hoping for is stability and then some good quality therapy, a psychological intervention that is going to help somebody, if you like, accept, but to process what it is that they've experienced and to let it go and get on with the rest of their lives.
Yeah.
And that's ultimately what the aim is.
That's brilliant advice. Thank you very much, Sylvia. And it is a long road to recovery. It is a case that these are very, very deep feelings, deep emotions.
Well, again, my experience is that, like I said earlier, that this behaviour starts as a way of resolving how you feel emotionally.
Yes.
Sadly, my experience as well has been around the trauma that people experience, particularly in childhood. Now, that's not to say that everybody who self-harms has had some experience of trauma. I think that it is slightly different in this younger generation in terms of their experiences and the pressures that they're under, and for both the good and the bad, social media also plays a huge role in that too.
Definitely.
So I think it is just very important that it is taken seriously and that an individual knows that support is available.
Thank you. Thank you very much, Sylvia, for your advice. You've been very, very honest, which is lovely to hear, but also very knowledgeable. And, you know, it is a case that every case is individual.
Absolutely.
Definitely.
Yeah.
So we are continuing the topic of self-harm. We have got our last guest, who is Trent Donaldson. And Trent is from Australia, and he's looking at self-harm from a teacher's point of view and somebody at university to support people who are self-harming when they're in the education system.
Right.
So thank you, Sylvia, and take care. Bye-bye.